I want to tell you about an organ system in your body that most doctors almost never discuss in a standard clinical consultation, that controls more of your biology than any other system we have covered in this series, and that the majority of modern lifestyles are systematically destroying, usually without any awareness that it is happening. Inside your gastrointestinal tract live approximately 38 trillion microorganisms: bacteria, viruses, fungi, archaea, and protozoa. An ecosystem of staggering complexity that evolved alongside the human body over millions of years. This is the gut microbiome, and it is not a passenger in your body. It is in many ways an organ in its own right. The gut microbiome weighs approximately 1.5 to 2 kilograms, comparable to the liver. It contains more genetic material than the entire human genome, approximately 150 times more genes than exist in all your human cells combined. Those genes encode functions that human cells cannot perform themselves: the synthesis of essential vitamins, the fermentation of dietary fiber, the production of short-chain fatty acids that fuel the cells lining your gut wall, the breakdown of compounds that would otherwise be toxic, and the training and regulation of your immune system. Your microbiome is doing biology that your own cells cannot do. You are, in a very real sense, not purely human. Here's what I want you to understand before we go any further, because I think it changes the entire frame of this conversation. The gut microbiome does not just affect digestion. It directly regulates three of the most important systems in your body. Your immune system. Approximately 70% of your immune tissue lines the gut wall, and the microbiome is the primary trainer and regulator of immune function throughout life. Your mood and mental health. Approximately 90% of your body's serotonin is produced not in the brain, but in the cells lining the gut, and the gut communicates with the brain via a dedicated two-way neural highway called the vagus nerve. And your metabolic health. The microbiome directly influences insulin sensitivity, adiposity, appetite regulation, and energy extraction from food. These are not peripheral effects, they are central biological functions. In this video, I am going to give you the complete clinical picture of gut health that most people have never received. I will explain what the microbiome actually does and why it matters so profoundly. I will cover the 8 signs that your gut microbiome is disrupted, many of which you would never connect to your gut without this video. I will explain leaky gut, what it actually is, what the evidence shows, and what it is not. I will cover the conditions most strongly linked to gut dysbiosis, and I will give you the 8 evidence-based actions that most effectively restore and maintain a healthy microbiome. This is the most broadly relevant video in this series because it touches every organ system we have covered. Let us get into it. Serotonin produced in the gut, 90%. The gut produces 90% of the body's serotonin, the primary mood-regulating neurotransmitter. Enteric Neuroscience 2025. The first and most clinically important function of the gut microbiome is immune regulation. Approximately 70% of the body's immune tissue, gut-associated lymphoid tissue, or GALT, lines the walls of the small and large intestine. This is not coincidence. The gut is the body's primary interface with the external environment. More antigens enter the body through the gut than through any other route. The microbiome trains the immune system from birth to distinguish between harmless molecules, food antigens, commensal bacteria, and genuine threats. A microbiome that is disrupted, dysbiotic, produces a dysregulated immune system that cannot make this distinction reliably. This is the mechanism most strongly implicated in the explosion of autoimmune and allergic conditions in industrialized countries over the past 50 years. The second function, the one that generates the most astonishment in clinical practice, is the gut-brain axis. This is a bidirectional communication network between the gastrointestinal tract and the central nervous system, mediated primarily by the vagus nerve, by gut-derived neurotransmitters, by immune signaling molecules, and by the short-chain fatty acids produced by bacterial fermentation. The gut contains its own nervous system, the enteric nervous system, sometimes called the second brain, containing approximately 500 million neurons. This system operates largely independently of the central nervous system and communicates continuously with the brain via the vagus nerve. The microbiome influences brain chemistry through the production of neurotransmitter precursors. Tryptophan, the precursor to serotonin, is largely produced through microbial action on dietary protein and through direct vagal signaling. The gut-brain axis is not a metaphor. It is a neuroanatomical and neurochemical reality with profound implications for mood, cognition, and mental health. The third function is metabolic. The microbiome ferments dietary fiber, the complex carbohydrates that human digestive enzymes cannot break down, producing short-chain fatty acids, butyrate, propionate, and acetate. Butyrate is the primary fuel for the cells lining the colon. Without adequate butyrate production, colonocytes undergo apoptosis and the gut wall integrity deteriorates. Propionate travels to the liver and influences glucose production and cholesterol metabolism. Acetate enters the systemic circulation and influences appetite regulation in the hypothalamus. The microbiome also influences how much energy is extracted from food. The same meal produces different caloric yield depending on microbiome composition, and directly modulates insulin sensitivity through inflammatory and short-chain fatty acid signaling. The fourth function is nutrient synthesis. The gut microbiome synthesizes vitamins that human cells cannot produce. Vitamin K2, the form responsible for directing calcium into bone rather than arterial walls, which we discussed in the vitamin D video. Several B vitamins, including B12, folate, riboflavin, and biotin, and essential amino acids from bacterial protein metabolism. This function is profoundly disrupted by broad-spectrum antibiotic use. A course of antibiotics that eliminates beneficial bacteria eliminates this nutrient synthesis capacity simultaneously, often for months or years after the antibiotic course ends. Dysbiosis, disruption of the normal microbiome, is not a single defined state. It is a spectrum of alterations in microbial diversity, composition, and function that can be caused by diet, antibiotics, stress, illness, medications, and environmental exposures. The key characteristics of a dysbiotic microbiome are reduced diversity, fewer species present, loss of key beneficial species including lactobacillus, bifidobacterium, Akkermansia muciniphila, and Faecalibacterium prausnitzii, overgrowth of pro-inflammatory species, and reduction in short-chain fatty acid production. Dysbiosis is not a disease in itself. It is a functional state that predisposes to disease through the immune, metabolic, and gut-brain pathways I described. Leaky gut, or increased intestinal permeability, refers to the breakdown of the tight junctions between the cells lining the gut wall. Under normal conditions, these tight junctions form a selective barrier, allowing nutrients to pass while blocking bacterial products, undigested food particles, and toxins. When tight junctions are disrupted by dysbiosis, by lipopolysaccharide from gram-negative bacteria, by certain dietary emulsifiers, by non-steroidal anti-inflammatory drugs, by chronic stress, and by excess alcohol, the gut wall becomes more permeable. Bacterial products, particularly lipopolysaccharide or LPS, enter the systemic circulation and trigger the chronic low-grade inflammatory cascade that we will cover in the next video on inflammation. Increased intestinal permeability is a measurable and real phenomenon. It is not a pseudoscientific concept. However, the wellness industry has significantly overclaimed its role in conditions where the evidence base is limited or preliminary. The strongest clinical evidence for gut dysbiosis links it to inflammatory bowel disease, Crohn's and ulcerative colitis, where dysbiosis is both a cause and consequence, irritable bowel syndrome, where microbiome disruption is increasingly recognized as a primary driver rather than just a functional complaint, type 2 diabetes, where specific microbiome signatures are associated with insulin resistance. Obesity, where microbiome transplant experiments in animal models demonstrate direct causal effects on adiposity. Depression and anxiety, where a growing body of evidence implicates gut dysbiosis in the pathogenesis of mood disorders. And autoimmune conditions, where early life microbiome disruption is associated with elevated lifetime risk. These are the signs most commonly associated with gut dysbiosis. Most of them are non-specific individually. They have many possible causes. But in combination, and particularly in someone with known risk factors for dysbiosis, they paint a clinical picture that should prompt microbiome-focused assessment and intervention. Sign 1. Bloating after meals, especially after fiber or certain vegetables. Bloating, the sensation of abdominal distension and discomfort after eating, is one of the most common and most clinically informative signs of gut dysbiosis. In a healthy microbiome, fermentation of fiber occurs in a balanced way that produces gas as a byproduct, but without excessive discomfort. In a dysbiotic microbiome, Abnormal fermentation by overgrown or mislocated bacterial populations produces disproportionate gas, particularly after fiber-rich foods, legumes, cruciferous vegetables, onions, that are normally highly beneficial. The irony is that the foods most beneficial to a healthy microbiome are often the most symptom-provoking in a dysbiotic one, which leads many people to avoid exactly the foods that would most help restore their gut health. Sign 2. Alternating constipation and diarrhea, the IBS pattern. Irritable bowel syndrome, IBS, affects approximately 10 to 15% of the global population and is characterized by alternating bowel habit, abdominal pain, and bloating without structural pathology. For decades, IBS was considered a functional disorder, real in its symptoms, but without an identifiable organic cause. The microbiome research of the past decade has fundamentally changed this understanding. Multiple studies now confirm that IBS is associated with specific patterns of gut dysbiosis, with altered gut permeability, with abnormal gut-brain axis signaling via the enteric nervous system, and with evidence of low-grade mucosal inflammation. IBS is not all in the mind. It is a disorder of the gut-brain axis with a significant microbiome component. Sign 3. Food intolerances that are worsening over time. An expanding list of food intolerances, foods that were previously tolerated but are now causing symptoms, is one of the clearest clinical signals of progressive gut dysbiosis and increased intestinal permeability. A healthy gut with intact tight junctions and a balanced microbiome can tolerate a wide variety of foods. A dysbiotic gut with increased permeability presents food antigens to the immune tissue in an abnormal context, triggering immune sensitization to foods that would otherwise be harmless. The progressive nature of this pattern, more foods becoming problematic over time, distinguishes it from a fixed genetic intolerance like celiac disease and suggests an underlying gut health issue that is driving the expanding symptom picture. Sign 4. Persistent low mood, anxiety, or depression. The connection between gut dysbiosis and mood disorders is one of the most rapidly evolving areas of clinical research. Through the gut-brain axis, via vagal signaling, serotonin precursor availability, and inflammatory cytokine production, a dysbiotic microbiome can directly impair mood regulation. Multiple human studies have now demonstrated that people with depression have significantly different microbiome compositions from controls, with reduced levels of key serotonin-producing bacteria, including lactobacillus and bifidobacterium species. Fecal microbiome transplant experiments in rodents have demonstrated direct transfer of depressive behavior alongside microbiome transfer. The clinical implication is significant. A person with treatment-resistant depression who has not had their gut health assessed may be missing a significant driver of their condition. Sign 5. Skin conditions. Eczema, acne, rosacea, and psoriasis. The gut-skin axis is increasingly recognized as a clinically important connection, sometimes called the gut-skin axis. Gut dysbiosis drives systemic inflammation via leaky gut and LPS translocation. This inflammation reaches the skin through the bloodstream and promotes the inflammatory cascades that underlie eczema, acne, rosacea, and psoriasis. Multiple observational studies confirm higher rates of gut dysbiosis and IBS in people with these skin conditions compared with controls. The most compelling evidence is in rosacea, where H. pylori infection and small intestinal bacterial overgrowth are significantly more prevalent in rosacea patients, and treating the underlying gut condition produces measurable improvement in skin symptoms. If you have a chronic inflammatory skin condition that has not responded to topical treatment, your gut deserves investigation. Sign 6. Recurrent infections and slow recovery. Given that 70% of immune tissue is gut-associated, it should not be surprising that gut dysbiosis compromises immune function systemically. The practical consequence is a pattern of recurrent infections, particularly upper respiratory infections, urinary tract infections, and oral infections, that occur more frequently than expected and from which recovery is slower than normal. This occurs through two mechanisms. Dysbiosis impairs the training and regulation of immune cells that originate in gut-associated lymphoid tissue and then circulate throughout the body, and reduced production of secretory IgA, the primary immunoglobulin of mucosal surfaces, in a dysbiotic gut reduces the first-line defense at respiratory and urogenital mucosal surfaces. Sign 7. Unexplained weight gain or difficulty losing weight. The microbiome's influence on weight is one of the most striking findings in gut research of the past decade. In landmark experiments, germ-free mice raised without any gut bacteria, that received fecal microbiome transplants from obese human donors became obese, while those receiving transplants from lean donors remained lean, despite identical diets. In human studies, specific microbiome signatures are associated with obesity, with differences in energy extraction from identical food portions and with altered leptin and ghrelin signaling that drives appetite dysregulation. People who struggle to lose weight despite adequate dietary restriction may have a microbiome composition that is extracting more energy from food, producing more pro-inflammatory signaling, and driving appetite in ways that make calorie restriction ineffective without addressing the underlying gut composition. Sign 8. Brain fog, poor concentration, and mental fatigue. The gut-brain axis connection means that a disrupted microbiome produces direct cognitive effects. Gut dysbiosis elevates systemic inflammatory cytokines, interleukin-1 beta, tumor necrosis factor alpha, interleukin-6, that cross the blood-brain barrier and impair neuronal function. These cytokines reduce the availability of tryptophan for serotonin and melatonin synthesis, producing simultaneously lower mood, poorer sleep, and cognitive sluggishness. Reduced butyrate production in a dysbiotic gut reduces the fuel available to the gut lining cells, increasing intestinal permeability and the systemic LPS burden that drives this inflammatory cascade. The cognitive symptoms of gut dysbiosis, brain fog, word-finding difficulty, poor concentration, mental fatigue, are neuroinflammatory effects, not psychological ones. Broad-spectrum antibiotics are the most potent single disruption to the gut microbiome. A single course of broad-spectrum antibiotics reduces microbial diversity by approximately 30% and can eliminate key beneficial species, Lactobacillus, Bifidobacterium, Akkermansia, that may take months or years to return, and in some cases, never fully recover. This does not mean antibiotics should never be used. They are life-saving when indicated. But the casual prescribing of antibiotics for viral infections, where they have no effect on the pathogen but guaranteed effect on the microbiome, is one of the most clinically consequential and most easily preventable causes of gut dysbiosis. If you receive antibiotics, always follow them with a targeted probiotic and prebiotic restoration protocol. Ultra-processed food destroys the microbiome through multiple simultaneous mechanisms. It is almost universally low in dietary fiber, the substrate that beneficial bacteria ferment to produce short-chain fatty acids. Without adequate fiber, beneficial bacteria starve and are outcompeted by less beneficial species. Ultra-processed food also contains emulsifiers, polysorbate 80, carboxymethylcellulose, carrageenan, that have been shown in animal models to directly disrupt the mucus layer protecting the gut wall and alter tight junction function. And it drives the overgrowth of pro-inflammatory bacterial species associated with obesity, metabolic syndrome, and inflammatory bowel disease. The correlation between the rise of ultra-processed food consumption and the rise of inflammatory gut conditions is not coincidental. Chronic psychological stress alters gut microbiome composition through the gut-brain axis, a bidirectional relationship. Stress hormones, cortisol and adrenaline, directly affect gut motility, gut permeability, and the immune environment of the gut, creating conditions that favor pro-inflammatory bacteria over beneficial commensal species. Stress also reduces the production of secretory IgA, the gut's primary immune defense, increasing susceptibility to pathogenic overgrowth. The relationship is bidirectional. Stress disrupts the microbiome, and a disrupted microbiome generates pro-inflammatory signals that amplify the stress response. This is one of the mechanisms through which chronic stress perpetuates itself physiologically. Other factors. Other significant microbiome disruptors include proton pump inhibitors, PPIs, which alter the gastric acid environment and allow bacterial overgrowth in the small intestine. NSAIDs, which directly damage the gut mucosa. Chlorinated drinking water. Alcohol, which disrupts tight junctions and promotes dysbiosis. A diet low in plant diversity, the largest predictor of microbiome diversity in population studies. And delivery by cesarean section, which deprives the infant of the critical microbiome seeding that occurs during vaginal birth. These 8 actions are ranked by evidence strength and practical impact. The principle underlying all of them is the same: restore microbial diversity and short-chain fatty acid production, repair gut wall integrity, and reduce the inputs that promote dysbiosis. Action 1. Eat 30 different plant foods per week. The American Gut Project, the largest citizen science microbiome study ever conducted, found that people who ate more than 30 different plant foods per week had significantly more diverse gut microbiomes than those eating fewer than 10. Plant diversity, not plant quantity, is the primary driver of microbiome diversity because different plant fibers and polyphenols feed different bacterial species. This means variety is the central dietary prescription. An apple, an orange, and a banana are 3 different plants. Broccoli, cauliflower, and kale are 3 more. Red kidney beans, black beans, and lentils are 3 more. 30 different plants per week is achievable with deliberate variety, and the microbiome diversity it produces has measurable effects on immune function, metabolic health, and short-chain fatty acid production. Action 2. Eat fermented foods daily. A landmark 2021 Stanford trial, published in Cell, found that a high fermented food diet produced greater increases in microbiome diversity and greater reductions in inflammatory markers than a high-fiber diet over 10 weeks. The fermented food group ate daily servings of yogurt, kefir, fermented cottage cheese, kimchi, sauerkraut, and fermented vegetable drinks. The effect on 19 different inflammatory markers, including interleukin-6 and interleukin-17A, was measurable and clinically significant. Fermented foods introduce live bacteria, provide substrates for existing beneficial bacteria, and reduce the inflammatory burden on the gut wall. The goal is 1 to 3 servings per day of genuinely fermented foods, not pasteurized products that contain no live cultures. Action 3. Prioritize prebiotic fiber. Feed the bacteria you want to grow. Prebiotic fibers are specific types of dietary fiber that preferentially feed beneficial bacteria, particularly lactobacillus, bifidobacterium, and akkermansia. The most clinically important prebiotic fibers are inulin and fructooligosaccharides, found in chicory, Jerusalem artichoke, garlic, onion, leek, and asparagus; resistant starch, found in cooled cooked potatoes, green bananas, legumes, and oats; and arabinoxylan, found in whole grain wheat and rye. Akkermansia muciniphila, the species most strongly associated with metabolic health, reduced inflammation, and gut wall integrity, is specifically promoted by pomegranate polyphenols, cranberry polyphenols, and the polyphenols in green tea and dark chocolate. These are foods, not supplements, and they produce measurable microbiome changes within weeks of consistent consumption. Action 4. Take a targeted probiotic after any antibiotic course. The evidence for probiotic supplementation is most robust in 2 specific contexts: during and immediately following antibiotic treatment, and in conditions associated with dysbiosis including IBS, antibiotic-associated diarrhea, and inflammatory bowel disease. For antibiotic recovery, the strains with strongest evidence are Lactobacillus rhamnosus GG and Saccharomyces boulardii, a yeast that survives antibiotic exposure and competitively inhibits pathogenic bacteria. Timing matters. Begin the probiotic at the same time as the antibiotic, separating each dose by at least 2 hours, and continue for at least 4 weeks after the antibiotic course ends. For general microbiome support outside the antibiotic context, evidence is more mixed. Probiotic supplements are less effective than dietary changes at producing lasting microbiome diversity. Action 5. Reduce ultra-processed food to under 20% of diet. Given the multiple mechanisms through which ultra-processed food disrupts the microbiome, fiber displacement, emulsifier effects on mucus, promotion of pro-inflammatory species, reducing UPF intake is both a microbiome intervention and a metabolic one. The practical threshold is below 20% of total caloric intake from ultra-processed sources. This is not a prohibition on all processed food. Minimally processed foods, including tinned legumes, frozen vegetables, and plain yogurt, are microbiome friendly. The targets are industrially manufactured products with ingredient lists containing emulsifiers, modified starches, artificial sweeteners, flavor enhancers, and preservatives, the category that produces the greatest microbiome disruption. Action 6. Manage stress actively. Protect the gut-brain axis. Given the direct effect of cortisol and sympathetic nervous system activation on gut permeability, motility, immune function, and microbiome composition, stress management is a direct gut health intervention. The vagus nerve, the primary communication pathway of the gut-brain axis, has higher tone during parasympathetic activation, the rest and digest state, and lower tone under sympathetic stress. Vagal tone can be directly increased through slow diaphragmatic breathing, 6 breaths per minute, through cold water face immersion, through humming and singing, and through regular meditation practice. Higher vagal tone is associated with better gut-brain axis function, lower systemic inflammation, and more diverse microbiome composition in observational studies. Action 7. Limit alcohol and avoid PPIs where possible. Alcohol at any dose above moderate consumption disrupts gut-tight junctions and promotes dysbiosis through its toxic effects on gut mucosal cells and its alteration of the gastric acid environment. Proton pump inhibitors, omeprazole, lansoprazole, pantoprazole, are among the most widely prescribed medications globally and among the most consistently associated with microbiome disruption. By elevating gastric pH, PPIs allow bacteria to colonize the upper gastrointestinal tract, an environment normally kept sterile by stomach acid, producing small intestinal bacterial overgrowth and altering the microbial environment throughout the gut. PPIs are essential for some conditions: reflux esophagitis, peptic ulcer disease, Helicobacter pylori eradication. But their casual long-term prescription for non-specific heartburn at doses far in excess of what most patients actually require is a significant and underappreciated cause of iatrogenic gut dysbiosis. Action 8. Exercise regularly. Physical activity is a direct microbiome intervention. Regular aerobic exercise independently increases gut microbiome diversity, independently of diet. Multiple studies, including a landmark 2018 trial in the journal Gut, demonstrated that exercise directly increased Akkermansia muciniphila, Faecalibacterium prausnitzii, and other beneficial species, and increased short-chain fatty acid production even without dietary changes. The mechanism involves exercise-induced changes in gut motility, altered gut blood flow patterns, and immune system adaptations that favor beneficial microbial populations. The effect is greatest with 150 or more minutes of moderate aerobic activity per week and is observed within 6 weeks of beginning regular exercise in previously sedentary individuals. Exercise is not just a cardiovascular and metabolic intervention. It is a direct microbiome intervention with measurable effects on diversity and short-chain fatty acid production. If you have been watching this series, something should be becoming very clear by now. The gut microbiome is not a separate topic. It sits at the intersection of everything we have covered. Gut dysbiosis drives insulin resistance, diabetes, and metabolic syndrome. It drives hepatic inflammation, fatty liver disease. It drives the systemic inflammation that accelerates atherosclerosis, heart disease, and stroke. It impairs the immune training that prevents autoimmune thyroid disease, Hashimoto's. It disrupts the gut-brain axis that regulates mood, depression. And it produces the nutritional deficiencies, vitamin K2, B vitamins, that compound every other metabolic problem in this series. Address the gut, and you address the root of almost everything we have discussed. I want to make a specific request with this video. The information that 90% of serotonin is produced in the gut, that your mood is directly influenced by the bacteria living in your intestines, is something that most people have never heard and that changes the way they think about mental health, depression, and anxiety. If you know someone who's struggling with mood, with unexplained gut symptoms, with autoimmune disease, with skin conditions that will not resolve, please share this video with them. The information in it may be the missing piece they have been looking for. Subscribe so you do not miss the next video, where I will be covering chronic inflammation, the single biological process connecting heart disease, cancer, Alzheimer's, and depression, and what you can actually measure and do about it. It is the most important mechanistic video in this series, and it will make everything we have covered make sense at a deeper level. I will see you there.